Total knee replacements are a standard procedure to restore function and to relieve pain in those with severely damaged knee joints. If you're considering this surgery, it's important to understand the process, the procedure, and what the recovery will be like. By the end of this video, you should have a good understanding of what to expect before going into a total knee surgery. Hi, I'm Josie Waddell, and I'm a licensed physical therapist at EW Motion Therapy. Today, we'll be going over how to prepare for a total knee replacement, the process of the surgery, and then how physical therapy can help you in your rehabilitation. Prior to the surgery, your orthopedic surgeon will go over your medical history and get medical reviews done, such as an imaging, blood work. They'll even do a physical assessment. Your surgeon will also review your medication so that they may stop or temporarily discontinue or reduce a medication prior to the surgery. They may also review your lifestyle. So this may include some weight changes, discontinuing smoking for better healing processes, and just overall improving your function prior to the procedure. Physical therapy can also help prior to the surgery with some prehab components. This may include strength training and range of motion exercises to promote a healthy knee prior to the procedure, which will only lead to better outcomes. They'll also want to educate you on functional tasks or walking with an assistive device that you'll need post-op. Physical therapy can also help with pain management, and this can include cold or heat therapies, TENS, and just gentle stretching and range of motion exercises. They can also help just restore function prior to the surgery with general function and activities of your daily life, but also help relieve any anxiety or stress that you may have about going through a total knee replacement. Next, we're going to talk about the knee replacement itself. They'll go in and give you an anesthetic, whether that's a general one or a local one. Then they'll make an incision on your knee and then go in to replace all the damaged cartilage and bone. They'll then go in and implant the artificial joint components. And once they're finished, they will close the incision. Then your physician will refer you to the next step, which is the physical rehabilitation process. Next, we'll discuss the post-op rehabilitation process and recovery timelines. This will vary based on many different factors. Some examples could be your age, your prior level of function, your health status, things like that. But post-op, while you're in recovery, so this will be in the clinic or in the hospital that you got your procedure in, will be mostly based on reducing risk of infection, healing, and just getting you ready to walk out the door. Once you're discharged to go home, you'll then start your outpatient physical therapy recovery. This first 2 weeks will be mostly on pain management and ambulating with an assistive device and just restoring your function as much as possible. It's really crucial in these first 2 weeks to get as much knee mobility and range of motion as possible. Then, leading into the next month, so 3 to 6 weeks after your procedure, there will be a gradual reduction of your assistive device. You'll also want to focus on your independence in your daily activities so that you can get back to what you need to do as quickly as possible. Overall, post-op PT for a total knee replacement should include good pain management, how to become independent with your daily tasks, walking without the need of an assistive device, regaining your range of motion, your strength, and your balance so that you can actively and safely participate in all the things that you want to do. Physical therapy sessions can vary in their frequency and intensity. This can include maybe a heavier session per week caseload, so 2 to 3 times a week. And then you can always stagger down as you start to reach your functional goals and outcomes. By the end of the first part of your rehab, you should be able to have good range of motion and strength so that your therapist can start working on more functional tasks such as walking, running, sport-specific things, again, based on the person. Total knee replacement surgery can be a life-changing experience for someone that is dealing with chronic knee pain and limited mobility. However, it's a significant procedure with its own set of risks. If you're still unsure about getting knee replacement surgery, it's important to explore all of your options and understand if this is the best route for you. Click the link in our description below to watch our video exploring knee replacements. This video discusses the pros and cons to getting a knee replacement and some risk factors for knee replacement surgery.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.